Bonjour tout le monde. Hello everyone. Bienvenue à la conférence de presse d'aujourd'hui, la deuxième ici. Donc, nous avons en présentiel Jean-Yves Duclos, ministre de la Santé, Omar Alghabra, ministre des Transports, et virtuellement se joignent à nous l'administratrice en chef de la Santé publique du Canada, Theresa Tam, et le sous-administrateur en chef de la Santé publique, Dr. Howard Njoo. Alors, on va commencer avec les remarques d'ouverture et ensuite, on va passer aux questions. C'est à vous.
Merci beaucoup. Bonjour tout le monde. Good afternoon, everyone. Je tiens d'abord à reconnaître que nous sommes rassemblés aujourd'hui sur le territoire traditionnel du peuple algonquin, Anishinaabe. Il me fait plaisir d'être parmi vous avec mon collègue, le ministre Alghabra, et la Dr. Tam et le Dr. Njoo, qui sont tous les deux avec nous virtuellement. As many of you are aware, the public health authorities in South Africa have confirmed that a new COVID-19 variant, B11529, also known now as Omicron, has been detected in that country. We are therefore acting quickly in order to protect the health and safety of Canadians. 5 different measures are being announced and implemented now. First, sorry, I'm trying to find my notes, but I'll do that in a more light manner. So first, we are banning the entry of foreign nationals into Canada that have traveled through Southern Africa in the last 14 days. Southern Africa includes 7 different countries: South Africa, Mozambique, Botswana, Zimbabwe, Lesotho, Eswatini, and Namibia. Second, for all those that have arrived in Canada in the last 14 days, we are asking them to quarantine now and to go for a COVID-19 test. To quarantine and to stay in isolation until they get the result of a negative COVID test. And to implement this, we will be working with provinces and territories. We are in touch with them. Third, Canadians and permanent residents and those with the right of entry into Canada will be tested on arrival. They will quarantine until they get the result of a negative test. They will then be allowed to go, if the test is negative, they will be allowed to go and quarantine in a safe and appropriate manner. They will be tested once more on day 8 until they finish their quarantine. Fourth, Global Affairs Canada is going to issue a travel advisory asking all Canadians not to travel to Southern Africa for the time being. And fifth, Canadians returning from that region who need to transit through a particular country will need to be tested in that country, that last transit country, before they can be allowed to come home. So these are the summary measures that we're going to put into place. I will now turn to Minister Alghabra for further details and input. Je vais maintenant le dire en français. Alors, commençant aujourd'hui, nous mettons en place des mesures pour protéger la santé et la sécurité des Canadiens. Nous mettons en place 5 différentes mesures suite à l'annonce de ce nouveau variant, le variant 1.1529, aussi connu maintenant sous le nom de variant Omicron. Première mesure, nous allons interdire l'entrée au Canada de tous citoyens étrangers qui ont séjourné dans le sud de l'Afrique au cours des 14 derniers jours, au cours des 14 jours avant leur souhait de venir au pays. Ces pays du sud de l'Afrique incluent l'Afrique du Sud, le Mozambique, le Botswana, le Zimbabwe, le Lesotho, Eswatini et la Namibie. Deuxième mesure pour tous ceux qui sont arrivés au Canada au cours des 2 dernières semaines, qu'ils soient canadiens ou étrangers. On demande à ces gens de s'isoler, d'aller faire un test COVID, d'attendre le résultat négatif de ce test COVID avant de sortir de leur période d'isolement. Troisième mesure, pour tous les Canadiens et les résidents permanents et tous ceux qui ont le droit de revenir au Canada, Ces gens vont devoir se faire tester au moment de leur arrivée à la frontière canadienne, vont devoir attendre le résultat de leur test pour démontrer que leur test est négatif, vont devoir ensuite faire une quarantaine de 2 semaines et se faire tester une autre fois autour du jour 8. Quatrième mesure, Affaires mondiales va émettre un avis pour décourager fortement tous les Canadiens de voyager au sud de l'Afrique. Et cinquièmement, les Canadiens qui retournent de la région du sud de l'Afrique vont devoir se faire tester dans leur dernier lieu de transit avant d'arriver au pays et de se soumettre aux autres mesures que je viens de résumer il y a quelques instants. Ministre Alghabra.
Merci, Jean-Yves. Good afternoon, everyone. Bonjour à tous. Speaking to you today from the traditional territory of the Algonquin Anishinaabe. As we've seen, the COVID-19 pandemic can change rapidly. The Government of Canada continues to take unprecedented and decisive action to protect the health and safety of all Canadians by introducing measures to prevent COVID-19 and new variants of the virus from being introduced and spread in Canada. Today, given the new, faster spreading variant of concern has been detected in Southern Africa, I am amending civil aviation requirements to address the situation. First, let me be clear. There are currently no direct flights to Canada from this region. Travelers who are flying indirectly will need to obtain a negative COVID-19 pre-departure test from a third country before continuing their journey to Canada. These countries include, as Minister Duclos highlighted, Lesotho, Botswana, Eswatini, Zimbabwe, South Africa, Namibia, and Mozambique. We are immediately requiring this third country testing for indirect flights from these countries, and it is a precautionary measure taking effect today until January 31st, while we assess the evolving situation and determine appropriate measures going forward. Foreign nationals who have traveled to any of these countries within the last 14 days will be barred from entering Canada. For Canadians and permanent residents who have traveled to any of these countries within the last 14 days, they must have a proof of a negative COVID-19 molecular test. The test must be taken within 72 hours of their scheduled departure to Canada. Upon entering Canada, they will be required to wait in an approved hotel until the result of their day one test result is known. If the test result is negative, they will be required to quarantine at home until their day 10 test is known. Notre priorité est de protéger la santé des Canadiens. The Government of Canada's top priority is protecting Canadians' health and safety, and our response to the COVID-19 pandemic is guided by the latest science and research. Merci. Thank you. Now I'll pass it on to Dr. Theresa Tam.
Thank you very much. So bonjour à toutes et à tous. Nationally, the daily case counts have been slowly creeping up, so we need to maintain a high degree of caution to avoid a rapid acceleration. Over the most recent 7-day period, on average, over 2,600 new cases were reported daily across Canada, which is less than 50% down from the peak of the fourth wave, when over 4,400 cases were reported daily. Currently, severe illness trends are still declining, but unless we can keep infection rates down, these trends could begin to rise again. Over the past week, an average of over 1,600 people with COVID-19 were being treated in our hospitals each day, including 471 in intensive care, and 20 deaths were reported daily. Over the past 24 hours, health authorities in Canada and internationally have become aware of the emergence of a new variant, which has a number of concerning features, the significance of which are still being assessed. This variant, which was first reported in South Africa, is currently known by the scientific designation of B.1.1.529. WHO has now classified it as a variant of concern and named it Omicron. Provincial laboratories across Canada have been alerted to this new variant and have searched for possible detections, but to date, there are no indications of the variant's presence in Canada. There have not been any identifications of this variant through post-arrival testing of international travelers to date. Although the epidemiological significance of this variant is still being assessed, it is considered unusual in that it has a very high number of mutations in two key areas of the virus's spike protein. One area of mutations is in the spike receptor binding domain, where the virus attaches itself and invades our cells, which could signify a potential for increased transmissibility of the virus. The other area of mutations is in what's referred to as the spike N-terminal domain, which is also known as the antigenic supersite, because it is a target for our body's defensive or neutralizing antibodies. So mutations to this area of the virus may impact our body's natural immunity, as well as potentially reduce immunity offered by vaccines. Hence, due to the potential for increased transmissibility and the possibility of increased resistance to vaccine-induced protection, we are concerned about this new variant and closely monitoring the evolving situation. Though challenges persist with this virus, we continue to make headway and can celebrate the achievements we're making along the way. After last week's approval of the pediatric formulation of the Comirnaty COVID-19 vaccine by Pfizer-BioNTech, provinces and territories have already booked tens of thousands of appointments for children aged 5 to 11 years. With the rollout of these pediatric programs, we now have an opportunity to reduce infection rates that have been disproportionately affecting the 5 to 11-year age group during the fourth wave. The primary aim is to protect this age group from infection and reduce disruption to their education and in-person activities that are so important for the mental and physical health and development. At the same time, there will be other indirect benefits for families and communities. With the eligible population now representing 95% of the total Canadian population, our vaccination firewall can only get stronger to better protect the most vulnerable Canadians. This includes children and infants under 5, and people of all ages who may not mount or sustain a strong immune response. As we said many times before, dealing with the formidable challenges of this virus requires ongoing caution and layering of individual protections. The emergence of new variants is unfortunately not unexpected, and the concerns raised by this variant further underscore the need to be vigilant. In addition to getting fully vaccinated, you can reduce your risk by properly wearing a well-fitted and well-constructed face mask in public or private spaces with people outside your immediate household, avoiding crowding and improving ventilation. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. À l'échelle nationale, le nombre de cas quotidiens augmente lentement. Nous devons donc rester très prudents pour éviter une accélération rapide. Au cours des 7 derniers jours, plus de 2600 nouveaux cas ont été signalés en moyenne chaque jour au Canada, ce qui représente une baisse de moins de 50% par rapport au pic de la 4e vague, où plus de 4400 cas ont été signalés chaque jour. À l'heure actuelle, les tendances des cas de maladies graves sont toujours à la baisse, mais si nous ne parvenons pas à maintenir les taux d'infection, ils pourraient être de nouveau à la hausse. Au cours de la semaine dernière, en moyenne, plus de 1600 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont 471 aux soins intensifs et 20 décès ont été signalés quotidiennement. Au cours des dernières 24 heures, les autorités de santé publique au Canada et à l'étranger ont pris conscience de l'émergence de nouveaux variants. Celui-ci présente un certain nombre de caractéristiques préoccupantes et son importance est toujours en cours d'évaluation. Ce variant, qui a été signalé pour la première fois en Afrique du Sud, est actuellement connu sous la désignation scientifique B11529 et maintenant, selon l'OMS, connu sous le nom Omicron. Les laboratoires provinciaux à travers le Canada ont été alertés de ce nouveau variant et ont recherché des détections possibles. Mais à ce jour, il n'y a aucune indication de sa présence au Canada et elle n'a pas été identifiée lors des tests effectués après l'arrivée des voyageurs internationaux. Bien que la portée épidémiologique du variant soit toujours en cours d'évaluation, celui-ci semble singulier dans la mesure où deux éléments clés de la protéine des spicules du virus présentent un très grand nombre de mutations. L'un des éléments porteurs des mutations est le domaine de liaison au récepteur S, c'est-à-dire le point qui permet au virus de se lier aux cellules, puis d'y pénétrer, ce qui pourrait se traduire par une transmissibilité accrue du virus. Les autres mutations se trouvent dans l'élément qu'on appelle le domaine N-terminal de la protéine de spicule, aussi appelé supersite antigénique, en raison du fait qu'il est la cible des défenses de l'organisme humain, c'est-à-dire les anticorps neutralisant. Par conséquent, les mutations dans cette partie du virus pourraient nuire à l'immunité physique naturelle, de même que potentiellement réduire l'immunité induite par les vaccins. Par conséquent, en raison de potentiel d'augmentation de la transmissibilité et de la possibilité d'une résistance accrue à la protection induite par le vaccin, nous sommes préoccupés par ce nouveau et suivons de près l'évolution de la situation. Bien que le virus nous pose encore des difficultés, nous continuons à faire des progrès et nous pouvons célébrer les réalisations que nous faisons en cours de route. Après l'approbation la semaine dernière de la formulation pédiatrique du vaccin Comirnaty contre la COVID-19 par Pfizer-BioNTech, les provinces et territoires ont déjà enregistré des dizaines de milliers de rendez-vous pour les enfants de 5 à 11 ans. Avec le lancement de ces programmes pédiatriques, nous avons maintenant la possibilité de réduire les taux d'infection qui ont touché de manière disproportionnée le groupe d'âge de 5 à 11 ans pendant la 4e vague. L'objectif principal est de protéger ce groupe d'âge contre l'infection et de réduire les perturbations de leur éducation et de leurs activités personnelles qui sont si importantes pour leur santé et leur développement mental et physique. En même temps, il y aura d'autres avantages indirects pour les familles et les communautés. Comme les personnes admissibles représentent maintenant 95% de toute la population canadienne, notre pare-feu vaccinal ne peut que se renforcer pour mieux protéger les Canadiens les plus vulnérables. Il s'agit notamment des enfants et des nourrissons de moins de 5 ans et des personnes de tous âges qui ne peuvent pas nécessairement développer ou maintenir une forte réponse immunitaire. Comme nous l'avons déjà dit à plusieurs reprises, faire face aux défis de ce virus nécessite une prudence continue et une superposition de protection individuelle. L'émergence des nouveaux variants n'est malheureusement pas inattendue et les inquiétudes soulevées par ce variant soulignent encore la nécessité d'être vigilant. En plus de vous faire vacciner complètement, vous pouvez réduire votre risque en portant correctement un masque facial bien ajusté et bien construit dans les espaces publics ou privés avec des personnes extérieures à votre foyer immédiat. Évitez les endroits bondés et en améliorant la ventilation. Merci. Thank you, Miigwech.
Merci beaucoup. On va passer aux questions. On va commencer par les questions dans la salle. Beaucoup de questions, donc on vous demanderait de garder vos questions et vos réponses courtes, mais droit au but si possible. Et ensuite, on va passer au téléphone. Alors, Louis?
Bonjour, M. Duclos, Louis Blouin de Radio-Canada. Juste préciser pour combien de temps ces mesures-là sont en vigueur. Puis, je voulais vous demander, est-ce que vous pouvez avoir la certitude que ce variant-là n'est pas déjà au Canada? Pas parce qu'on ne l'a pas détecté qu'il n'est pas nécessairement ici. Quelle certitude pouvez-vous avoir que ce variant-là n'est pas déjà présent au Canada?
Merci. Bien, je trichais un petit peu pour résumer là, ce qu'on vient d'annoncer. C'est un petit peu compliqué pour plusieurs personnes, probablement. Donc, il y a des mesures pour les étrangers, des mesures pour les Canadiens. Première mesure pour les étrangers, c'est qu'ils ne pourront plus rentrer au Canada s'ils ont séjourné depuis moins de 2 semaines dans le sud de l'Afrique. Pour les Canadiens, 4 mesures différentes. La première, c'est que s'ils sont déjà au pays, on leur demande déjà de se mettre en isolement et d'aller se faire tester pour la COVID-19. Et pour s'assurer que ça se passe bien, on travaille avec les provinces et les territoires. J'ai déjà eu des échanges ce matin avec mes collègues des provinces et des territoires. La deuxième chose, c'est que s'ils reviennent au pays, ils doivent se faire tester dans leur dernier lieu de transit avant de revenir au pays. Lorsqu'ils arrivent au pays, ils doivent se faire tester à la frontière, attendre que le résultat soit négatif avant de se déplacer dans un lieu de quarantaine approprié, de se faire tester une deuxième fois pour compléter leur quarantaine. Et la dernière chose, c'est que Affaires mondiales Canada va émettre un avis pour décourager fortement tout voyage dans le sud de l'Afrique. Maintenant, combien de temps ça va durer, c'est évidemment à voir. On fait ça pour une approche que j'appelle bretelles et ceinture, pour être vraiment sûr, bouclé, certain qu'on est le plus prudent possible, comme on l'a été durant toute la crise de la COVID-19. Et c'est pour ça qu'on va continuer d'évaluer la situation avec l'aide des scientifiques, évidemment. Et s'il y a des cas déjà au Canada, ça, on n'en a pas vu. Évidemment, on doit toujours se méfier, mais l'Agence de la santé publique et ses partenaires à travers le pays vont continuer leur travail solide là, pour s'assurer de protéger la santé et la sécurité des gens partout où ils habitent.
On voit que vous avez décidé d'agir rapidement. Quelles leçons passées avez-vous apprises pour avoir décidé d'agir vite? Parce qu'on vous avait reproché d'avoir pris votre temps ces derniers mois.
C'est-à-dire que oui, on a fait ce reproche et je pense qu'on peut toujours faire des reproches au gouvernement canadien. Si vous faites allusion au début de la crise de mars 2020, oui, ça avait peut-être pris 2 ou 3 jours avant qu'on ferme la frontière avec les Américains, mais on avait à l'époque un président américain dont on devait se méfier, avec lequel il fallait travailler correctement pour s'assurer d'une catastrophe sanitaire et économique. Mais vous voyez, on est un des pays à agir le plus vite, mais non seulement à agir le plus vite, mais avec une série de mesures extrêmement solides. Si vous comparez ce qu'on fait maintenant au Canada par rapport à ce qu'on trouve ailleurs dans le monde, on a l'ensemble de mesures probablement le plus solide, même si on est un peu plus distant du continent africain. Évidemment, on n'a aucun vol direct, comme disait le ministre Alghabra, avec le sud de l'Afrique. Donc, on sait que les gens qui doivent retourner au pays ou venir au pays après un séjour dans le sud de l'Afrique doivent nécessairement passer par un autre pays et se soumettre à d'autres étapes de surveillance là, et de tests. En anglais? So, what we're announcing today may seem a bit complicated to average Canadians, so let me try to summarize briefly. We have measures for foreigners, foreign nationals, and measures for Canadians. For foreign nationals, they will not be able to come into Canada if they have traveled or spent time in the last 14 days in Southern Africa. For Canadians, if they have already entered into Canada, we ask them to isolate themselves now, to quarantine if they have spent time in the last 14 days in Southern Africa, to be tested and to exit their quarantine only, obviously, if their test is negative. The second thing we're asking them to do, if they are planning to come back to Canada, is to be tested at their last airport transit point. We also are going to asking them to, when they come through an entry point, to be tested, to wait for their negative test to be shown, and then to go to an appropriate quarantine place, to stay in quarantine for 14 days, and to be tested a second time at a further date. And finally, Global Affairs Canada is asking all Canadians to refrain from traveling to Southern Africa.
It's Tom Perry from CBC. Thanks for taking our questions. What I wanted to get you on was, I guess, the lessons that you've learned from dealing with previous variants and previous outbreaks. How has that affected this time? But if I could ask you specifically, for people who have been in Southern Africa, people who are already here, are you requiring them to quarantine? Are you going to be tracking them down and asking or telling them to quarantine?
So for those, and to be very reassuring to Canadians, we are speaking about small numbers. And Minister Alghabra could be even more precise, but we are talking of an average possible maximum number per day of 50 people, and that is including everyone. So these are small numbers, and we have the capacity to work with them and with provinces and territories if they have already arrived in Canada. So we're asking them, and that will be mandatory through an order in council. So we're asking them to isolate, go they get tested and wait until they get a negative test result to exit their isolation period.
On the lessons you've learned from that you've learned from previous outbreaks, how has that impacted the speed with which you're rolling this out this time?
Well, we've obviously, and Dr. Tam in her office have done that really well. We've obviously been accustomed with time working with our partners, scientific and political and operational partners. So we have been in touch with them over the last days, and we have followed and supported their measures, and now we're able to announce complementary measures using what I call a belt and suspenders approach. Belt and suspenders, because yes, it may seem an overreaction from some perspective, but it's really to be following an abundance of caution principle. Now, we really want to make sure that we do all we can and need to do to protect the health and safety of Canadians.
Dr. Tam, do you think it's going to be possible, despite all these measures, to keep this variant out of Canada?
Yeah, thank you for the question. We know very little about this variant right now, including how transmissible it is and whether it increases severity of illness or what the impact is on the vaccine. But because of so many mutations in specific areas of the genome, we're taking this precautionary measure. But as you know, that it's very difficult to keep a virus like this out entirely. So I would not be surprised if many countries over the next days, now that they've been alerted, might go back and try and find out if the virus had already arrived. So I expect, like some of the European countries, I believe Belgium just very recently found a case, and others might too. So the border is never 100%, but each layer provides an additional layer of protection. So I think in answer to, a prior question, what we know is out of all the virus genomes that we have in Canada and the viruses that we are able to detect, we haven't found this virus. We're continuously working with a network of genomics network, the Canadian COVID Genomics Network, to continuously try and identify the variant in any new samples, any ones that were still in progress in our pipeline. We'll be looking for it. And I don't think people should be surprised if we did get a detection. What we're trying to do is make sure that people who've come from that area of the country are now being quarantined. I'll just have to stress that anyone who's unvaccinated, of course, in the last 14 days would have been obliged to go into quarantine and undergo our testing measures already in place. We have pre-arrival test, pre-departure testing, of course, but the day 1 and day 8 test and quarantine still applies to anyone from that area of the world who's unvaccinated. So it's really the vaccinated people, anyone who's exempt, who haven't had to undergo the quarantine measures. We have the tools now, including ArriveCan, where we can rapidly trace where these individuals are, who they are really, and having their contact information so that there'll be more rigorous follow-up to ensure that they are getting tested and that they remain in quarantine until the test comes back negative. So not every layer is perfect, but we're trying to apply more layers to increase our protection.
It's Dr. Njoo. Maybe I could just add one additional point to what Dr. Tam has said. And, as part of our ongoing surveillance to detect a potential variants of concern, even at our border right now, travelers who come to Canada, fully vaccinated or not, have to go what we call mandatory random testing, right? So we are taking sort of a prudent approach, not being able to test everyone. That the volumes might preclude that, but about 7,000 to 8,000 travelers coming to Canada are selected for mandatory random testing. So that's another way in which we can get samples and then test them to see if they are maybe a variant of concern. So that's another layer as part of our ongoing efforts in terms of surveillance and possible detection of variants of concern here in Canada. Thanks.
It's Michael Couture with Global National. This is a question for the doctors. I wanted to know how would you classify the level of threat that this new variant is to Canada, to Canadians? Not only of it reaching our shores, but if it does get here, considering all the mutations, Dr. Tam, that you were talking about, do we know how it could affect fully vaccinated people, or even worse, the unvaccinated population that we continue to have here in Canada?
And for that question, vaccine still is fundamentally the most important layer of protection that people can layer on, and people should continue to get fully vaccinated, get a booster if you're in the eligible age groups or groups according to your provincial schedules, and kids now. We actually don't know the impact of this variant on vaccine effectiveness, and that data may not be available for a little while. I know that laboratories around the world that have access to this virus are looking at this right now. And vaccine manufacturers, you've probably seen some news from Pfizer-BioNTech saying that they're doing work to look at whether this new variant impacts their vaccines. But that has to be done in the next days. So while there's all these unknowns, these precautionary layers of protection are being applied. I think that we still don't know if it's more transmissible. There's certainly signals in South Africa itself that in one region, one of the localized areas, that there's been acceleration in the number of cases. We still don't know whether that's because they have more relaxed public health measures, or whether this virus has gained a biological advantage over what's already present in Southern Africa. So, but we will keep the public informed as we learn more about those characteristics.
And just as a question for the ministers here in the room, we know that the number of countries now is 7. What plans are in place to possibly broaden this, given how quickly we know variants can quickly spring up in other countries, or now seem to take root in different countries? So it feels like this is step 1. What's step 2 in trying to broaden this travel plan?
Thank you. Thank you for the question. As I've said, and as the Minister Duclos said, we're acting quickly and decisively based on the information that we have. And as Dr. Theresa Tam also said, we'll always continue to monitor the data that we're receiving from around the world, the data that we're receiving from our testing at the border, and we will take additional precautionary measures if necessary.
But sorry, just to follow up. So we're just at a list of 7 for now. Do you have others that are sort of on a list that you're looking at now that we could need to ban people from?
If we need to adjust this list of countries based on the information that we have and based on the doctor's advice that we receive, we will do so. For now, it is just these 7 countries, but we will constantly reevaluate and assess the list of those countries.
Christopher Nardi from the National Post. The first question is just a technicality. When you say people who have kind of basically transited through one of those 7 countries, what does that mean in terms of length? Is it a layover? Is it you have to be there for 24 hours? What does that mean in terms of length of time spent there?
I'll take this question. We already, by the way, have measures, and we've implemented measures like this from other countries when we had a NOTAM or a banning of direct flights like India and Morocco. And this is an additional measure for people who are flying indirectly. So to get off the plane in the 3rd country where they're stopping and go get tested. Sometimes there are facilities at airports. Sometimes they need to leave the airport. But the requirement is that they get tested from their last destination, last city that they've transited from. This is an added precautionary measure. So we are actually learning from other lessons and from other situations, and this is an added layer of protection.
Sorry, what I meant was how long do you have to spend at any point in one of the 7 countries that are targeted to then not be eligible to come back directly? That's what I meant, sorry.
As long as you spend any time over the last 14 days, you are required to do so.
The other question, I was seeing this morning, Hong Kong officials were reporting that they had actually detected a case in a Canadian or someone who had traveled from Canada to Hong Kong, who happened to have a room in the quarantine hotel next to someone who had also been diagnosed, but from South Africa. As you mentioned, Dr. Tam, earlier, you know, we've started to see these cases pop up. Is there any indication that that traveler from Canada might have had the variant? And, you know, why choose those 7 countries if, as Dr. Tam mentioned, Belgium, we found cases from Egypt and et cetera, et cetera?
I should turn to Dr. Tam on the nature of those cases and whether the Public Health Agency of Canada is aware of those cases.
Yes, thank you for the question. As I've said, many countries might start detecting these types of variants, this particular variant, over the next day, so we'll have to keep monitoring that. So far, the other countries have either detected it in travelers or there's potentially fairly close contact, meaning being in the same hotel as another case. So if we see, though, community transmission or more widespread transmission in a certain country, we will have to evaluate those countries. At the moment, we're casting our net a little wider than South Africa itself and Botswana, where there's a contiguous country with land borders. So we have widened the net a little bit around South Africa itself. For the rest of the world, we have to monitor very closely. So far, though, the other countries haven't really reported any widespread transmission. We will follow up, of course, with Hong Kong authorities. It is most likely that this individual caught it elsewhere, but never say never. We want to just follow up to see if it's anything that we need to trace back to in Canada from that particular traveler, if we can get that information as well.
Chris Nashkate, CTV National News. My first question is for the ministers. Given everything that has been just said right now, how worried should Canadians be about this new variant?
I think Canadians should be prudent, as they've been for many, many months. I think Canadians have demonstrated, certainly favorably compared to other countries, that in Canada we are following public health advice. We are vaccinating and vaccinated in very large numbers compared to many other countries. So let's keep the good things that we've been doing. And as Dr. Tam said, that is not only protecting us from the current viral environment, but also from what new variants and this variant could bring as challenges to our country.
I mean, I don't want to repeat what Minister Duclos said, but I'll add is that the pandemic is not over yet, and there are sometimes voices that wanted us to remove the pre-departure testing upon arrival and other type of rigorous and prudent and important measures at the border. This is a reminder why we need to be cautious. This is also a reminder why vaccines are important and why we have been implementing vaccine mandates in different sectors and why we've been requiring travelers to be vaccinated. This is another reminder how serious the situation that we're in today and how cautious we all need to be. I think, as Minister Duclos said, Canadians need to continue to be prudent, but also recognize that we've been doing really well when it comes to vaccination rate and public health, following public health advice, and we need to continue doing so.
And Mr. Alghabra, you said there are currently no direct flights to South Africa. You mentioned the measures in place now because of this new variant. Do you believe all of this is enough to keep this variant out of Canada? You know, you think back about what Dr. Tam said, and we look back at the Delta variant getting into Canada. The Conservatives today said they think the government is not moving fast enough on the measures being put in place.
We have been taking, from the beginning of the pandemic, again, decisive and immediate actions. And we've adjusted our measures and we've implemented layers of measures. And I highlighted some of them just a second ago. And Dr. Tam said, you know, you wouldn't be surprised if we end up finding this variant here at home. What we need to do is we need to do everything in our power to prevent it from entering our country and be ready for it if it does. And the way we are ready is implementing, again, all of those policies, precautionary measures. And I, you know, you mentioned the Conservatives, so I have to say I call on Aaron O'Toole to ensure that his MPs are vaccinated. Is really they need to set an example to all Canadians and ensuring that they are vaccinated and to support us in our vaccine mandate. To support, I call on them to support us in our border measures. So we need to work together. Canadians need to see all elected MPs to work together to advance the safety of Canadians.
Merci. We'll take another question in the room before turning to the phones.
Erica Ibrahim from Canadian Press. What will be the response in Canada if the variant is detected here?
Well, we rely on the expertise and now the experience of the public health officials. Now, I think Canadians are proud of not only what they have done individually, including being vaccinated in large numbers, but they are also proud of the leadership that experts, scientists, including those within PHAC, the work that they have done. So we will continue to protect the health and safety of Canadians. And again, I mean, Dr. Tam said earlier that one thing that we must absolutely do is to get vaccinated. There are still approximately 3 million Canadians 12 years and older who haven't received a single dose of vaccines. We are, among all comparable countries, the best country in terms of vaccination record over the last months, but we can do better. And it's now the time, if people haven't done so yet, now the time to be vaccinated in order to protect against the future, whatever the future may be.
This is from you as well, Minister Duclos. You'll be participating in a World Health Summit Monday. What's Canada's position on a global convention to prevent pandemics, and would that have helped us prevent this current pandemic if one was already in place?
Well, our position has always been that we are stronger when we work together. So we, not only do we have the benefit of working with other organizations in other countries, but these other countries also have the benefit of working with us. So in fact, Canada has demonstrated in a couple of very important instances a significant degree of scientific leadership. And if you are interested, Dr. Tam could expand on that. So that level of policy and scientific leadership is a sign that we can do even better in the future as we collaborate with WHO and other organizations in order to prevent the incidence of future pandemics and protect Canadians against such things.
Merci, and we'll go to the phones. Opérateur, c'est à vous.
Thank you, merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. The first question is from Erica Walsh from the Globe and Mail. Please go ahead.
Good afternoon, ministers. Thank you so much for taking my question. I just wanted to revisit the question on the countries where you have these travel rules now in place. Can you explain a bit more why, if we're seeing it in Belgium connected to Egypt, why those countries also aren't affected by this travel?
Minister Alghabra, in a moment, there are two reasons for that. First, as Dr. Tam indicated, the center of the current source of concern is within South Africa. And as Dr. Tam said, we are widening the net. We are expanding the set of countries around South Africa to include Southern Africa. The second thing is that, as Minister Alghabra also mentioned, there are no direct flights to Canada. So there are additional screens from which we benefit because other countries are also imposing stricter measures at their own borders. So we are doubly protected, not only because of what we're announcing today, which is extremely significant, and I think it's going to be incredibly appropriate, at least in the short term, to protect against this new virus, but also because we're in collaboration with other countries that have their own screening operations. So doing that in this joint manner is a benefit for Canada and for Canadians because of our particular geographic situation. We are able to doubly protect Canadians, and that's why I believe, and I think we would believe, that the announcements this morning are the right announcements.
Thank you so much.
Can I just add as well, Marika, the fact that, I mean, we are adding these extra layers to countries that we believe there's community transmission of this variant, and we're ready to always assess this list. But I just want to remind you and all Canadians that we currently have in place measures for the rest of the world. So, for example, we're requiring all arrivals to be fully vaccinated, to be tested prior to departure, to be subjected to mandatory random testing upon arrival, to Canadians who are arriving who are not vaccinated to be quarantined and tested. So we have layers and upon layers of measures to all travelers coming from all over the world. Today we're announcing additional measures for particular countries of interest, and we're saying that list can increase or adjust depending on the data and depending on the advice that we get. Thanks.
Okay, thank you. My other question is on a different topic. I mean, what onus or accountability do rich countries in the world have for this situation? That it's exactly what health experts around the world warned about 3 or 4 months ago, that because we vaccinated ourselves first and we did not donate in adequate numbers to developing countries that do not have the finances to pay the high dollar value for vaccines, that we are now in this situation where we do see such a worsening case with this new variant. What accountability does Canada and rich countries have for that?
Good question. And in fact, we have two responsibilities. First, to look after the health and safety of Canadians. And second, as you suggest, it's also to help other countries that may face more difficult challenges in getting their population vaccinated. And we've done the two over the last months. We have successfully vaccinated a very large proportion of the Canadian population, among the largest vaccination rates in all of the OECD countries, and that's been the case for many months now. And second, we have not only promised 200 million doses over the next year to countries that need their population to be vaccinated, but we've already started to deliver millions of doses to those countries. So we're working on both sides because, as you said, this is the only way through which we will be able to exit the pandemic at the global level.
Merci. Prochaine question au téléphone.
Merci. La prochaine question de Marie Vastel, Le Devoir. La parole est à vous.
Oui, bonjour. Ma question est pour la Dr. Tam. Dr. Tam, I wanted to ask you about third doses and booster shots. I understand that we don't yet know the efficacy, I don't know the word, but efficacy of vaccines on this new variant. But I wonder if the fact that this new variant has appeared, does that affect in any way when we should offer third doses to the general population? I wonder if the fact that there's this new variant maybe leads public health experts to think that we should push those third doses earlier because of the variant, and also, as the holidays are upon us and people might gather a little bit more?
Yes, thank you for the question. I think right now the booster doses, as you said, is essentially targeted at the highest risk, and that's really important, and that anyone in those groups should go and get the booster. That's the first thing. For the general population, we're already beginning to examine the policy related to that with the National Advisory Committee on Immunization and with the provinces and territories. And that will carry on regardless of whether this variant is in Canada or not. So that work is actually continuing. And for the most part, the bulk of the Canadian population would have received the vaccine, the last dose, somewhere between 5 and 6 months right now. So I think that the interval for that third dose likely to be somewhere between 6 to 8 months for different groups. So that is actively being examined as we speak. And we'll certainly provide updates once the expert committees and the chief medical officers have had another round of discussion. I don't know that this variant changes that trajectory. We will learn a little bit more about it in the next days to come. But I still think that our booster strategy continues to be examined and actively. And so we'll have more to say about that. In the holidays, though, I have to say that, as I've said, that over the winter months and working towards spring, I predict that there'll be ups and downs in our epidemic trajectories. And given that, we do have to exercise a degree of caution over the Christmas and New Year period. I know people are very anxious to get back to the social settings, but I think that keeping on the layers of protection, masking, ventilation, and distancing and gathering with people that you know and you know their vaccination status and keeping up as many layers of protection is really important for now. And so I think that over the next months until we get out of the winter into the spring period and we know more about variants such as this, the degree of precaution is important. At the same time, I am still an optimistic person. We have so many more tools than we've had than before against any emerging variants, and whether it be detection. We're now examining even more antiviral therapies. So we've just got to hold on, be precautionary, and the longer that we can keep our infection rates down and our hospitals not being overwhelmed, the more tools we'll have, I think, even over the next months.
Thanks. My other question, I think, is also for you, mais peut-être aussi pour Monsieur Duclos. I just want to circle back on people who have already come back from these 7 countries in the last 14 days. You said they have to quarantine. I understand you said that, we have the ArriveCan app, and so we should know where these people are, but I'm still not clear on the question my colleague asked earlier. How exactly are you going to actually enforce that these people have to get tested again and that they quarantine? Vous pouvez répondre aussi, M. Duclos, si vous voulez. Je ne vais pas répéter ma question en français par souci de temps, mais vous pouvez répondre aussi.
Merci. Bien, je peux peut-être commencer, effectivement, et Dr. Tam ou Dr. Njoo pourront peut-être continuer. Alors, le message est très simple. C'est qu'à partir de maintenant, on demande aux Canadiens qui sont revenus au pays après avoir passé du temps dans le sud de l'Afrique depuis 2 semaines. Donc, ils peuvent être ici peut-être depuis 3 jours, mais avoir été il y a 1 semaine dans le sud de l'Afrique, ces gens-là, on leur demande de s'isoler, de se faire tester, d'attendre le résultat de leur test négatif et ensuite de pouvoir sortir de leur isolement. Alors, c'est ce qu'on leur demande maintenant et rapidement, au cours des prochaines heures, à la limite d'ici la fin de la semaine, il va y avoir un décret qui va demander exactement à tous ces membres, qui va exiger de tous ces gens de le faire.
Did Dr. Tam want to answer?
Oui, il y a 3 méthodes, je pense, pour alerter, signaler aux voyageurs qui viennent d'arriver de régions d'Afrique du Sud. Premièrement, par la communication de presse comme ça. Deuxièmement, travailler étroitement avec mes homologues de province et de territoire parce que si un voyageur est entièrement vacciné, il n'y a pas maintenant d'exigences pour la quarantaine. Donc, c'est vraiment important pour nous de travailler avec la santé publique locale, provinciale, pour renforcer cette politique. troisièmement, on a maintenant un outil, ArriveCan, dans lequel il y a enregistré les pays, les endroits où on a voyagé pendant les derniers 14 jours. Dans un autre outil, on va utiliser pour augmenter, pour assister, pour cet effort. Mais comme tous les efforts, ce n'est pas 100%. On va avoir la coopération du grand public, les voyageurs qui retournent du Sud-Afrique, pas seulement pour les autres, mais pour eux-mêmes et pour leurs familles aussi. Pour leurs familles, s'ils ont des nouveaux variants, c'est beaucoup mieux si tout le monde le connaît le plus rapidement possible. Merci.
Merci beaucoup. We have time to squeeze in one more question on the phone, then we'll try to get one last question in the room. Opérateur, c'est à vous.
Thank you. The next question is from Hannah Jackson from CTV News. Please go ahead.
Thank you. My question is for Dr. Tam. I'm wondering if you can provide an update on when Canadians can expect to see COVID-19 vaccines available for babies and toddlers.
Canadiens vont voir.
Yes, my colleagues in Health Canada has indicated that they have not received a submission for that age group as yet. Pfizer and Moderna are continuing to complete their clinical trials for that youngest age group. They believe that the earliest, I think, we will see vaccines for that age group will be in the new year. There may be submissions towards the end of the 2021, but that remains to be seen. So I think the Pfizer data in particular may be available by the end of 2021, which still means that we will not be implementing this program, I don't think, until early 2022.
Thank you.
Do you have a follow-up? Okay.
No, that's it for me. Thanks.
Okay, thank you. We will finish with one last question.
Minister Alghabra, it's Tom Perry from CBC again. I just want to ask you, for Canadians and permanent residents who are in that region right now, there are no direct flights. They're going to have to transit through somewhere, get tested at that transit point. But if countries like the US, European countries are putting their own restrictions in, how are Canadians and permanent residents who are trying to get back to Canada, how are they supposed to get home?
Thanks, Tom. Look, you know, for the last year and a half, we've been cautioning Canadians about travel. We are asking them to always pay attention to travel measures as countries, depending on their own situation, epidemiological situation, may change. So we've been asking them to pay close attention to travel measures, to border restrictions, and now, like you said, they're required, if they wish to come back, to get a third country test. If any individual, if any Canadian citizen is having a hard time figuring out how to get back home, I encourage them to call the Emergency Watch Response Center at Global Affairs Canada to speak with an official or the embassy or the consulate and explain their situation, and they will try to work with them on figuring out how to get them back home safely.
Will the government be offering, though, any kind of specific assistance? I don't know how many people are going to be in this position, but if there are people in that position, are you going to be helping them to get home?
As you recall, Tom, we mobilized a fleet of airlines to help Canadians at the beginning of the pandemic, when the pandemic took us all by surprise, took the entire world by surprise. Since then, we've been encouraging Canadians to pay close attention, and we have been working. Most Canadians have delayed and postponed their discretionary travel, and I want to thank them for doing so. Some have had to travel for urgent reasons, and we've worked with any Canadian who has been stuck abroad. So we will monitor our emergency watch response center based on the number and the volume of cases. But I would encourage any Canadian who needs help to reach out to our global affairs to explain what their situation is.
Merci beaucoup et ceci met fin à la conférence de presse. This is the end of the press conference. Merci beaucoup. Au revoir.